Hello, welcome to this video where we are talking EJs, external jugular access points. This is going to be a two-part video. First part, we're just going to describe the EJ and some points around the skill. And then on the second half, we're going to demonstrate the skill and what it looks like, right? EJ stands for external jugular. This is technically a peripheral line. I know it seems fairly central comparative to more distal sites like the hand or AC, but technically it is peripheral, so we can access this in EMS. Some common patients who are going to be needing this, really anyone who desperately needs IV access for one reason or another, but you just can't get it, all right? So this is going to be septic patients, trauma patients, cardiac arrests, medical activates, really anyone exhibiting signs of shock. And again, this is not an exhaustive list. This is not every single scenario, but these are some common culprits for illnesses that might require an EJ, or they might be a good candidate for one, all right? This isn't just for your patient where they're stable and we're going to the hospital. I guess I'll throw a line in them. Yeah, I'll just pop a line in their neck. No, you're planning on doing something with this EJ site, all right? It is a little more invasive. Usually it's a much larger gauge, and this isn't going to be something we're going to consider unless they're critically ill. If you're not able to get the EJ, don't worry, there is always the IO, okay? But this is kind of, before we're going to that, hey, let's consider an EJ, because there's a good chance you could throw one in pretty simply without even having to IO them. Some technique points are raising their legs. If you are able to do this safely, and if your patient's condition and presentation allows you to do that, you can raise their legs. I know some stretchers, you can physically lift up on the legs and they kind of hitch into place higher, and that's going to raise intracranial pressure, momentarily kind of engorging those veins, and it's just going to make them pop a little easier, all right? If your patient is able to bear down, again, if this is clinically relevant for them in the moment, like they're conscious and fairly, I wouldn't say stable, your EJ patient most likely isn't stable, but if they are able to bear down and they're not naturally doing that, that will also make those veins pop. Just like any skill, whether it be distal IV or intubation or decompression, whatever it is, you should set yourself up for success and make the skill as easy as possible for you, okay? This is a large vein, so you can use a big needle. I'm thinking 16s, 18s maybe, but 14, 16, those are going to be probably your bread and butter here, all right? So don't be afraid to go big, all right? Again, this is a sick patient, they need it, and you can be aggressive with this. Another tip is going to be to use a shallow angle. This is a very superficial vein, really on the outside of the skin here, and I don't need a very harsh angle. I can lower that pretty substantially just to make sure I don't pierce through the other side. Let's show you some examples of looking for these sites, and then we'll do the skill. Now let's demonstrate showing you this. Okay, so I am laying supine on the ground, and I have my feet propped up here on a chair. Again, if you're able to do this and it makes sense for your scene and your patient, go ahead and do this. This is going to help you. Now, I want you to go vein shopping. You're likely going to see EJs on both sides, but I want you to look at both sides because one is probably going to be more prominent and easier to access than the other, all right? So I am not even bearing down, and you can see this EJ site pretty easily, all right? And this is on my left. And let's go ahead and move it over to my right. All right. Now you can really see, it looks like it's quite a bit larger here, okay? Let's make them pop even. I'm just gonna take my index and I'm just gonna kind of put some pressure right above the collarbone where you can see that EJ go in. I'm just gonna put some pressure on there, okay? And I'm not bearing down, I'm just, I don't know, just chilling, and you can see that EJ. And let's do it on the other side. Okay, awesome. Now what I want to do is I'm going to bear down, or act like you have to cough really hard or something. That's that side. Let's do it to the other side. So fairly good examples of what that might look like. Now I'm going to strap on a trainer and let's do the skill. All right, now we're to the point where we're actually going to do the skill. I have a training mannequin with a slick little EJ trainer, and we have identified the site. It's pretty easy to see right here. So how do I actually go about getting an IV in here? It's kind of an awkward angle comparative to some flatter areas like an AC or a wrist or a hand. It's also at a different angle. It's perpendicular to me. And so starting this, I'm probably going to want to kind of turn the head to the side, given I am able to do that with my patient's condition. All right. So let's go ahead and make sure I have my supplies correct. I have a 16 gauge, I got a flush with a lock, I got 2 pieces of tape here, I have a Tegaderm and something to clean my site, as well as some gauze here. So I've identified my EJ site. I'm going to tear this open. There you go. All right, I'm going to turn the patient's head to the side here, and I'm going to wipe the area clean. Okay. Let me open this trainer up so I can actually use it. And like we talked about before, I'm going to apply some traction above and below. I'm going to kind of occlude at the base of the neck and kind of the nook of that collarbone to kind of make it pop. But I'm also going to take my thumb and apply some upwards traction just to keep that skin nice and taut so that I don't lose my site as skin or adipose tissue doesn't roll over it. Okay. From here, I need to make sure I have my needle. Alrighty. So I got the patient's head turned to the side. I'm keeping the skin relatively taut. And I'm going in at a more shallow angle than I would a traditional IV. Okay. All right. Now, this is a large vein. There could be a lot of blood here, so I am going to occlude at the base of this catheter. I found that to be a pretty successful way to stop bleeding from coming out, as opposed to going really like distal. I'm going to go pretty proximal, like just the end of that catheter, all right? And I'm going to put pressure there. Okay. Got my drawback. Awesome. I'll take this off. And realistically, this is kind of wet, whether it be diaphoresis, blood, whatever. And I want this to stay in place. And Tegaderms, tape, they don't like moist skin. I'm going to okay, so I got my Tegaderm on. Now this would fit over the ear pretty good. You don't have to do that, but just do something with this. You could loop it across the face here, but if this was my patient right here, I would honestly probably just loop this around the ear, tape it on there, and then what I like doing, you don't have to do this, this is just a Taylor thing. I like putting a little tape at the bottom of my Tegaderm and a little tape at the top. Losing an IV is not fun, especially one that you worked pretty hard for on someone who really needs it. That's the EJ skill. Hopefully this helped you guys, and if there's anything else I can help provide you for this skill or anything else, just reach out. Thank you.